your student nurse from South University. I'll wash my hands and we'll get started with your head to toe assessment.
Okay.
Are you allergic to any medication or latex?
No.
Okay, patient is sitting straight up, legs are crossed in front, no obvious illness or odor, dressed properly for the weather and the occasion. Mood is proper for the occasion. Speech is fluent and no signs of stuttering or slurring. Do you know where you are?
The hospital.
You know why you're here?
For a head to toe assessment.
You know what year it is?
2015.
Alright, patient is alert and oriented, ×3, person, place, and time. Can you say your name for me?
Jordan Hutchinson.
And your birthday?
5'10".
Alright, are you experiencing any pain today?
A little bit in my knee.
Yeah, your knee, how'd this start?
I was walking.
Alright, how long has it been going on?
About a week.
About a week, alright. Does anything make it feel better or worse?
Keeping it elevated makes it feel better.
Alright. Does it radiate anywhere?
A little bit down my leg.
Yeah. On a scale of 0 to 10, 10 being the worst pain, can you rate the pain for me?
Probably about a 6.
Alright. Do you want any medication for this pain?
No, that's okay.
No? Alright, well I'll put it in your chart and let your doctor know. I'm going to start with your head. I'm just going to touch your scalp. Hair is evenly distributed. No signs of lesions, masses, no excess moisture, no balding. Alright, I'm just going to touch your face. Skin is warm to touch. Skin color is consistent with ethnicity. No lesions or masses. No bruising on the face. Eyes, nose, ears, mouth are symmetric on the face. Head is symmetric on the body. I'm just going to touch your eyes. Alright, conjunctiva is pink and glossy. No signs of inflammation. No excess crusting pus, no excess redness. Alright, I'm going to test cranial nerve 5. Can you shut your eyes and let me know where I'm touching on your face?
Forehead. Chin. Cheek. Other cheek.
Alright, cranial nerve 5 is intact. Can you raise your eyebrows? Squint your eyes real tight. Puff out your cheeks. Smile. Alright, cranial nerve 7 is intact. Now I'm going to check your eyes. Eyes, like I said before, are symmetric. Pupils are equal and round. I'm going to do the pupillary light reflex. Can you just look forward for me? Okay. Pupils can have direct and consensual constriction bilaterally. Alright, can you follow my pen light in? Alright, pupils constrict and converge. Bilaterally as well. Pupils are equal, round, reactive to light, and accommodate. Alright, I'm going to check your mouth now. Can you open your mouth for me? Alright, buccal mucosa is pink. No signs of lesions or swelling. Gums are a pink color, no bleeding, no inflammation. All teeth seem like they are present, no teeth missing. Tongue is pink, no coating, no lesions on that. Can you stick your tongue out and say ah for me? Alright, tonsils are a 1+. Uvula moves upward and is midline. Alright, great job. I'm going to go down the neck. Skin is still warm to touch down here. I'm going to go down the arms. Hair is evenly distributed. No bruising, no lesions, excess moisture, no masses. Alright, capillary reflex refill is less than 2 seconds. No signs of clubbing, anything like that. I'm going to check your carotid, palpate them. Alright, carotids equal bilaterally, and I rate them as a 2+ because they're not weak or bounding. I'm just going to auscultate them for signs of breathe. With my bell, can you breathe in for me and then exhale and hold your breath? Alright, breathe, and again. Alright, no signs of whooshing or swishing, which means there's no bruise present. I'm going to move on to your heart. I'm going to check the aortic area at the second intercostal space to the right of the sternum. Okay. And the pulmonic to the left of the sternum, second intercostal space. S2 is louder up here. I'm going to check the herbs to the left sternal border at the third intercostal space. All right, can you just place your breast for me? And the tricuspid at about the fourth or fifth intercostal space left of the sternum. And the mitral, which is mid-clavicular line at about the fifth or sixth intercostal space. S1 is heard louder down here, and I would stay here for 60 seconds and listen for the apical pulse. Then I would go back up with my bell in the same way I came down. No signs of abnormal murmurs, no S3 or S4 sounds, so that's good. Now I'm going to listen to your lungs. Every time my stethoscope touches you, can you take a breath for me?
Yep.
All right, I'm going to start at the first intercostal space. Okay. All right. No adventitious wheezing or crackling on the front. I'm just going to check the back. Can you turn a little bit for me? I see you have 2 piercings down here at the bottom. Have there been any pain with them?
Nope.
No? All right, no signs of infection, inflammation, or anything like that. All right, I'm going to check your breath sounds back here. Just every time my stethoscope touches you again, can you take a breath?
Yep.
All right, you can breathe normal now. All right, no adventitious sounds on the back as well. I heard no crackling, no wheezing. Can you lean forward for me so I can check your spine? All right, spine is straight, no protruding vertebrae at all. All right, you can sit back up. AP diameter is 1 to 2, no barrel chesting. Let me know if you feel anything, all right? No. Oh, all right, CVA, there's no tenderness with that. Can you lay it down for me? Right, let me put this below here. There you go. No, I'm gonna pull this up. All right. Abdomen is flat. No rounding at all. I see you have a few nevi on your abdomen. Have they been there your whole life?
Yep.
Yep. Have they changed in shape at all?
No.
All right. All of them are less than 1 millimeter in diameter. Borders are clear and round. They don't seem to be elevated. They're light brown. I see that you have a scar underneath your umbilicus. Can you tell me what that's from?
Previous piercing.
Previous piercing, right? No signs of infection there. There's a piercing on the top of the umbilicus. Is there any pain with that at all? No. All right, no signs of crusting or inflammation, no infection. All right, I am going to also take All sounds were present in all 4 quadrants. I am now going to percuss. Right, go up on it. erythropathy in all four quadrants, but there will be dullness over the liver and the spleen, and sometimes in the left lower if there's fecal matter in the colon. All right, I'm going to palpate now. Right lower quadrant is going to be the cecum and appendix. I'm going to look at the patient for signs of tenderness. Right upper quadrant is going to be the gallbladder and the liver. Left upper quadrant is going to be the stomach and the spleen. Left lower quadrant is going to be the sigmoid colon and the descending colon. Do you have any tenderness in any of those areas? All right, no signs of tenderness in the abdomen. Patient showed no tenderness as well. All right, I'm going to take this cloth and move this one up and down. All right, I'm gonna have you sit up. All right, JVD was not present. All right, I'm going to continue down the legs. Can you uncross your legs for me? Thank you. Skin is still warm to touch. No signs of bruising or lesions, no masses. Hair is evenly distributed. I see a couple of nevi. Have those always been there?
Mm-hmm.
Yeah. Change in shape at all?
Nope.
No? All right. They are less than 1 millimeter in diameter and not raised or irregular. All right. I'm going to check for edema in the ankles. All right. Edema is not present. I'm going to do the popliteal pulses. All right. Popliteal pulses are equal bilaterally. I'd rate them as a 2+. They're not weak and not bounding. I'm going to come down to the posterior tibial pulse. And these pulses are also equal bilaterally. I'd rate them as a 2+, not weak or full and bounding. I'm going to do the dorsalis pedis pulses. Once again, equal bilaterally, 2+, not weak or full and bounding. I'm going to do capillary refill. Less than 2 seconds. I'm going to come back up and do the brachial pulses. So they're both equal bilaterally as well. 2+, they're not weak or full and bounding. We're going to do the radial pulses. Equal bilaterally, I'd rate them as a 2+. They are not weak or full and bounding. I'm going to do the Babinski test now. Can you relax your ankles? Whoa, I almost just fell over. Babinski's test is negative, no curling of the toes. Can you grab my fingers and pull down? All right, grip is definitely intact. I'll pull this out for you so you can stand up. Stand up on the ground. All right, can you close your eyes? And I'm checking the Romberg test to see for any swaying or abnormal movements with the eyes closed. I check for 20 seconds. All right, you can open your eyes. Romberg test is negative. Can you walk to the wall and back for me? All right, patient has a steady gait, no signs of swaying, shuffling. Ambulation is intact. And that's it.